Hey, this is Abby Sutton, and I'm going to be performing a head-to-toe assessment today. This is my note card. I only have one, front and back. I'm going to place it in my pocket. Hey, good afternoon. My name's Abby. Can I get your first and last name and your date of birth?
Abby Taylor, 10/31/2000.
Okay, can I check your wristband verification? Perfect, thank you. Today we're going to be doing a head-to-toe assessment to assess your body's functioning and all the organs and the system, how they're working together. I'm going to provide you some privacy. First off, we're going to start with your skin. Upon inspection, her skin is even and consistent with her genetic background. Now I'm going to palpate her skin. Her skin was equal and warm throughout her body and her upper and lower extremities, and which means she has good circulation. Now we're going to move on to your head. Upon inspection, her head is normocephalic and symmetric. Now I'm going to palpate her head. Her head is symmetric and smooth and free from any lesions. Now I'm gonna assess your facial movements. Can you squint your eyes shut? Can you wrinkle your forehead? Puff your cheeks? Bite down on your teeth? And then smile? Okay, perfect. Cranial nerves 5 and 7 are intact, and she was able to do all the facial movements. Now we're going to move on to taste her sense of taste. Will you close your eyes for me, and I'm gonna present you with a snack. And just tell me if you taste salty, sweet, bitter, or whatever.
Salty.
Okay, perfect. She was able to identify the taste, and so cranial nerve 7 is intact. Now I'm going to palpate your sinuses, your frontal and maxillary. Did you feel any pain or tenderness?
No.
Okay. She noted no pain or tenderness after palpation of her sinuses. Next, we're going to move on to your eyes. Let me inspect your eyes. Okay, her sclera is white and the conjunctiva is free from any crusting or lesions. Now I'm going to assess your perla. So I'm going to assess the how your eyes constrict. Her eyes are constricted bilaterally in both sides. Now we're going to assess your accommodation. So can you look far off and then look at the pen light when it gets closer? Perfect. Her accommodation is intact. Her pupils are equal, round, reactive to light, and accommodation is intact. So cranial nerves 2 and 3 are intact. Now I'm going to do the diagnostics positions test. So can you follow my finger with your eyes without moving your head? Okay. Cranial nerves 3, 4, and 6 are all intact. She was able to follow my finger with her eyes without moving her head. Now I'm going to get my ophthalmoscope and assess her optic fundus. The red light reflux was present in bilaterally in both eyes, and I was able to see the retinal structures, macula, and optic disc all in the optic fundus. Next, we're going to move on to your ears. Upon inspection, her ears are equal bilaterally, and now I'm going to palpate them. Do you feel any pain or tenderness?
No.
She felt no pain or tenderness upon palpation. Now I'm going to inspect inside her ear canal. The ear canal was clear, and I was able to see the tympanic membrane, and it was a pearly gray color, and it was concave. And I was able to see the cone of light in the right ear at 5 o'clock and the left ear at 7 o'clock. Now we're going to do a few hearing tests. So can you turn that way, and I'm going to whisper a few words, and you're going to repeat them back to me. And will you include your right ear first?
5AB.
Okay. And the other way. You put your left.
7AC.
Okay. Cranial nerve 8 is intact, and she was able to hear through her occluded ear. Now we're gonna do the Weber test, and I'm gonna strike my tuning fork, and I'm gonna place it on top of your head, and you're gonna tell me if you hear more from each other side, or if you hear it on equal on both
Equal.
sides. Okay, she heard the sound equal through both sides of her ear, so there was no lateralization noted. Next, we're going to move on to your nose. Upon inspection, her nose is in the midline and it is symmetric and proportional. Now I want you to include your right nostril and sniff in and breathe. And then your left. Okay, she has good patency and there was no occlusion when she was breathing in. Now I'm going to test your sense of smell. So will you close your eyes for me? And I'm going to present you with a smell.
Garlic.
Okay. Cranial nerve 1 is intact and she was able to tell me the correct scent. Now I'm going to move on to the mouth. Can you open wide for me? Will you lift up your tongue? Okay. The buccal mucosa, the soft and hard palate were all present, and they were all pink and soft, while the tongue is a pink and more rougher surface, and then the frenulum and posterior pharynx is all intact. For detention, I saw no missing teeth or dental caries. Now I want you to repeat after me, light, tight, dynamite.
Light, tight, dynamite.
Okay, cranial nerve 12 is intact and she was able to repeat the words back to me using her lingual speech. Now I'm going to assess your gag reflex. Okay. There's an instant gag reflex and there's no uvular deviation. Okay, now I'm going to, do we already do taste? Okay, now I'm going to move on to her neck. Upon inspection, her trachea is in the midline. And now I'm going to palpate. Okay, there's no tracheal deviation or shifting. Now I'm going to palpate her lymph nodes. Pre-auricular, posterior auricular, occipital, submental, submandibular, superficial, cervical, deep cervical and posterior cervical, jugular to gastric, and supraclavicular. Did you feel any pain or tenderness when I palpated?
No.
The patient noted no pain or tenderness when I palpated, and they were non-palpable, all the different lymph nodes. Now I'm going to also take your carotid artery. Well, first I'm going to palpate. Okay. There were her pulse was a 2+ pulse, full bounding. Now I'm going to also take. Okay, there was no bruise heard after auscultation. Now we're going to move on to the respiratory system. You already stood up. I'm just going to examine your AP to transverse ratio. It seems that your it's going to be 1 to 2, which is good for her AP transverse ratio. And now I'm going to also take your anterior chest. there is no adventitious sounds heard. Now I'm just gonna inspect your normal breathing, so you just sit there for a few seconds. Okay, her breathing is non-labored. Now can you stand up for me? I'm gonna check your chest expansion. Turn that way and breathe in 1, 2, 3. Okay. You can sit back down. There is no lag in expansion, and my thumbs moved apart equally. Now we're going to move on to the heart. I'm going to start by auscultating all the locations. First, I'm going to start off with the aortic, which is in the right second interspace. Now the pulmonic, which is in the left second interspace. Now the tricuspid, which is in the left sternal border, left lower sternal border. And then the mitral, which is in the fifth interspace. Okay. S1 and S2 were heard, and there was no murmurs present. Now I'm going to feel your peripheral pulses. So I'm going to start off with your radial bilaterally. Brachial. And posterior tibialis. And dorsalis pedis. Okay. All the pulses were equal and consistent bilaterally in her upper and lower extremities. They were all 2+ pulse. Now I'm going to assess for capillary refill. So can I see your fingertips and your toes? Okay. Her capillary refill is very prompt, and the blood flowed back within less than 3 seconds in her upper and lower extremities. Now we're going to move on to the abdomen, so can you lay flat for me, please? Okay, so her head is slightly higher than the rest of her body and abdomen. And when you pull up your shirt so you're exposing your stomach. Okay, first I'm going to percuss her abdomen in all 4 quadrants. Okay, there's stiffening heard in all 4 quadrants of the abdomen. Now I'm going to auscultate. Okay, that I heard normal active gurgling high-pitched noises, which is all normal for the abdomen and stomach. So now I'm going to lastly palpate her stomach superficially first. Did you feel any pain or tenderness?
No.
Okay, the patient noted no pain or tenderness after palpation, and I felt no masses. Now I'm going to palpate deep palpation. Did you feel any pain or tenderness?
No.
Okay. She noted no pain or tenderness, and I felt no abnormal enlargement of any organs. You can sit up for me now. Now we're going to do the musculoskeletal part of the assessment. So these are going to be more range of motion exercises. So will you stand up for me? And I want you to tilt your head to the left, right, and then forward, back, and then all the way around. Okay, now I want you to put your arms out, flip them, and then pull them in, and then go back. Okay, now the same thing with your leg, right leg out, and then back, and then flex it. Okay, and then your left, out, and then flex. Okay, now so that's for your spine, so we bend down and touch your toes. Okay, and we go back for me, and then just twist. Okay, perfect. You can sit back down. Now I'm going to assess for her muscle strength. So will you put your arms out, and I'm going to apply force against, and I want you to pull up. Okay, and then your legs. Okay. Her strength was adequate, and I would her muscle strength is a +5, upper and lower extremities bilaterally. Now I'm going to assess cranial nerve 11. So when I push down on your shoulders, I want you to push up against resistance. Okay? Cranial nerve 11 is intact, and she was able to push up against resistance. Now we're going to move on to the last part of the exam, which is the neurologic part. We're going to start with a cerebellum test, and you're going to have to stand up. And we're going to do the Romberg test, and I want you to just stand there for about 20 seconds with your eyes closed, and I just want you to maintain posture and balance, and I'll be here if you have to fall. Okay, perfect. She was able to maintain posture and balance the whole time, so that is a negative Romberg test. Now we're going to do the tandem walk, so I want you to just act like you're walking on a tightrope, so like this. And you can turn back around. Okay, she was able to walk on the with the tandem walk, and she maintained posture and balance. So those were her two cerebellar tests. Now we're going to move on to a coordination test. You can sit back down. All you do here is just touch your finger with all of your fingers on both sides. Okay, perfect. That was the finger-to-finger test, and she was able to touch all of her fingers, so that was her coordination test. And now for the last test, we're going to do the last two tests, we're going to do sensory tests. And I'm going to use one of these cotton tip swabs, and this side will be the dull side, and this side will be the sharper side, and you're going to tell me which one you feel. So will you close your eyes?
Soft. Dull. Sharp. Dull. Sharp. Sharp.
Okay, she was able to adequately tell me the difference between the sharp and dull pain in her upper and lower extremities. Now we're going to do another test. It's kind of the same thing. You're just going to tell me now when you feel the sensation is felt.
Now. 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 Now.
Okay, same thing. She was able to feel all the senses felt every time. Thank you.